In this video, we're going to be looking at the iceberg analogy. The iceberg analogy can be really helpful for clients to start to recognize some of those underlying concerns that they have. You can draw out the iceberg and then show some water level, and the tip is showing. Depending on whether the client has concerns around alcohol, drugs, or gambling, or maybe all of them, you can label the tip as some of those behaviors. What we want to do is invite the client to explore with us what are some of the underlying things that we can't see. So sometimes it's pretty obvious if someone has substance use concerns. For example, they might smell of alcohol, or they might be stumbling when they come in, or they might look under the influence. Some of those things are a bit more obvious, but some of the underlying concerns that people can't see right away. So some of the things that clients will often talk to us about is that they have trauma. Sometimes it's those mental health concerns, maybe anxiety, depression, psychosis, mood disorders. Sometimes it's financial concerns, maybe housing instability, relationship challenges, stress, grief, and invite the client to explore some of those concerns that may not be quite so obvious. Then you can have a discussion with them regarding how the alcohol and the drugs and the gambling may be very adaptive in their life, as it helps to push down some of these concerns. If only for 40 minutes, a few hours, a few days, it helps to push those concerns down. And then, as we know, that once this is removed, all of this will then come to the surface. And so explaining to the client that coming to Forecast or getting support in their housing is not just about removing the substances, it's about inviting people to maybe use substances in a safer way, maybe gamble in a way that's less harmful. It might be about getting education around their substance use, it might be around cutting back, or it may be around abstaining if that's what the client so chooses. And the other part of the work that we're doing is, how do we then manage these symptoms? So how will I manage my mental health symptom of anxiety if I don't have the alcohol to push that down? What other coping strategies or perhaps psychiatric medications would need to be in place for me to feel more successful around that? This can be very helpful as well when you're working with others in the community, helping them to understand that although Forecast is certainly here to treat the addiction piece, it's only one of the pieces. And all of this needs to be addressed as a way for the client to feel like they're living a whole and healthy life.